Hi everyone, I thought I'd reach out and just share with you because I've had a lot of questions lately about why are we social distancing. So let me share with you some of the reasons why we're social distancing and the logical process that we're going to go through. I'm in a fortunate situation that I am a statistician, I work with the government, I engineer processes, I have friends that work in the front lines of COVID, and we also have a healthcare arm to our business. So we know what's going on, and it's a unique opportunity to see the overall picture. So I want to share that with you today and help you close some of the gaps. Now, social distancing is there to stop the spread of the infection. So what are some of the facts? Well, the main fact is that contamination is occurring through what we call droplets or mucus spreading. So when we speak in a normal situation, you might not be aware of it, but we are actually moving droplets out into the air with about 1 metre to 2 metres. Now, if I cough, that can go up to 4 metres in range, or if I sneeze, that can even go beyond if you're down breeze. Now, once the droplets are out of our body, they tend to live outside of the body between a few hours to several days. So that's why it's important that we wipe down areas that we've been in contact with, and we refrain from public areas in this phase. Now the virus, some people say, well, I haven't got the virus, why can't I go and actually connect with people? Well, you don't know if you have the virus because it has what's called an incubation period. Now the incubation period can go between 2 and 14 days typically, and in some rare cases up to 30 days. So you could be walking around and your friends and family could be walking around feeling healthy and happy. That's a great situation. What's not a great situation is if you were infected and incubating and you're spreading that to others. And this is why social distancing is important right now. Now, the infection period, if you are unfortunate enough to catch the virus, will vary from person to person, depending on your immune system, your state of health, and your state of mind. And when I talk about state of mind, there's a few things that we can do to boost our immune systems to prevent us from getting sick and giving us the best chance of fighting off an infection if it is in our space. Now physically, ideally we need to keep clean and keep our hygiene high, but we need to do the same thing for our state of mind. So holding states of gratitude will raise your dopamine, will raise your endorphins, will then raise your oxytocin, and will raise your serotonin. Now those 4 chemicals put you in a state of flow. Those chemicals make you feel happier. And when you're in those states, it's scientifically proven that your immune system rises with it. So it's really important that you be aware, that you collect the facts, but you don't go into a state of fear, which tends to generate what we call cortisol. That chemical will diminish your immune system and make you more susceptible to infection. So if you want to practice gratitude, we've got a group that we've put together on Facebook called the Growing Gratitude Community. Come and join us, post up some of your great content, tell us the things that you're happy about and the things that you see in the community, these acts of kindness, and we'll raise our immune systems together. Now, I want to also stress that social distancing is not equal to social isolation. I've had a few people approach me coming into states of depression because they're misinterpreting what social distancing means. Social distancing means to keep our physical space free of interaction of others. It doesn't mean to stop interacting with others. In fact, you want to increase your interaction with others and use the beautiful modern technology that we have today so that we can maintain those connections with the people that we love and care about. If anything, it's a great time to declutter our lives at the moment and really focus in on what's purposeful and meaningful and make deeper connections with those that we care about. Now let's move on and explain what are the 3 phases of social distancing. Now the initial isolation period is all about going through the populace and isolating so that we stop the contamination and we slow down the rate of contamination. But the second reason behind that is so that we can have 2 to 4 weeks to really discover all of these individuals that have incubated the virus. Because within 4 weeks, anyone that had the virus will start showing signs, or they would have started to make a recovery. Now, once we identify those, they will either stay in further isolation and recover before they come back to the general populace, or if they are not feeling well, they will move into a care facility. Now, in the care facility is the next stage of isolation. We isolate those that are critically infected to make sure that they don't spread the virus back into the general populace. And we will give them the best chance of recovery by keeping them in high technical care facilities with skilled technicians. This introduces the next stage of risk. So we have a whole minor population here then that are infected, where our healthcare workers are providing amazing care. These healthcare workers become under strain and under stress, so it's really vitally important that we psychologically and physically help these people stay up at this time of strain and make sure that they don't use any risky techniques that bring the infection back to the general populace. So our healthcare workers will be isolating, cleaning, under strain, seeing some horrible things going on, but seeing a lot of amazing things going on too. So it's important that we support these workers, that we have good process in place to make sure that the infection control is in check, and that we get through this period quickly as possible. Now the third phase is the country or the region isolation. Now we might get a place like Australia under control. We're fortunate enough to have water surrounding our borders, so the infection, once we control it, we can keep it in check. Now it can be once we start letting people back into regions, countries and houses that we reinfect the population. So it's important that we stamp this out first, and that once we go back into a state of mobilising and reconnecting with people physically, that we are having stringent processes in place to identify anyone that might be a risk to the community. So the last part is we return to normality. I can guarantee you at some stage we will all go back to a normal state of living. Between now and that point in time, we need to be self-disciplined, we need to be respectful, we need to keep our state and mindset of gratitude high, and we need to learn from what we've learned in the past. Ideally, we learn from this and we move some of our investments that are going into arms into protecting the general humanity as one species. Because we are one species on this planet, and we should act like it. Thanks for listening today, and look forward to speaking to you more in the future.